We saw an incredible overall survival benefit of over a year, close to 16 months.
And we're delighted to be joining you from San Antonio, where we've been experiencing the onslaught of new data that we're hopeful will impact on patient outcome as we think about some of the new therapies we'll be talking about. And to start us out today, I'm going to ask Dr. Cruz if you could sort of put in perspective, since we're going to sort of focus on HER2 subset of breast cancer, if you could sort of put into perspective for us what the Cleopatra regimen is briefly. I think most people know, but what the impact of that treatment has been, basically for the last decade.
Yeah, I mean, I think Cleopatra is transformative. We've been very lucky that for the better part of a decade, we've been able to use the regimen of a taxane with trastuzumab and pertuzumab for first-line care of HER2-positive metastatic breast cancer patients. And part of the reason that we love this data is we saw an incredible overall survival benefit of over a year, close to 16 months, that was sustained over long-term follow-up. And when you look at these curves, you see that many patients are still alive up to 8 years out from the start of the trial. And I think we've all had the experience that patients who respond to that regimen, you always have those that have long-term responses. And so it's a regimen that we feel confident in. It's a regimen that patients feel good on. And it's really changed the natural history of this disease where, becoming more of a chronic illness for many of our patients, which I don't know that we thought was possible over a decade ago.
So Dr. Ballinger, let me ask you, because we're going to get into some of the nuances of this trial compared to some of the newer data. And, one of the things that's unique about Cleopatra is you stop the chemotherapy. And I just wonder if you could comment on the mechanics of the study in a sense.
Yeah, I mean, I wasn't practicing at the time, but I think at the time it was
fine.
I just wanted to drive that home, but at the time, I think that was a very novel idea to do that kind of induction therapy followed by maintenance. So the fact that patients can do the more toxic chemotherapy part up front and then remain on maintenance trastuzumab, pertuzumab that's much better tolerated and, like you said, sustain a response. And maybe some patients are even cured. So I like that induction sort of mechanism. And I think as we talk about newer data, trying to think about how that all fits together.
So we have, a lot of experience with Cleopatra. We have these patients who may be cured, but certainly are out long-term on H&P, doing well. And, I think it probably is still the minority. I mean, nobody's, out 5 and 10 years. There are many folks. But that really highlights the point that this isn't the final answer to treating patients with HER2-positive metastatic disease.